Matthew Perry's autopsy came out. Cause of death, acute effects of ketamine. What is that? Matthew Perry was receiving ketamine infusion therapy to treat depression as part of his recovery. But the amount found in his system has raised flags. Why? Because there was a lot of it. And there were other narcotics found. So, what was this really about? Let's bring in internal medicine and addiction specialist, host of Ask Dr. Drew, Dr. Drew Pinsky. First thing, best for you for the holy days and best for the new year. Always good to see you, Doc. Thank you. Explain to the audience what ketamine is and why anybody would use it for that kind of treatment.
So ketamine is a dissociative anesthetic. We use it in emergency rooms for adolescents and children in particular in rather large quantities as an anesthetic because it's safe. People breathe quite reasonably if they're monitored carefully while they're on that medication. It's begun to be used for the treatment of recalcitrant depression. So if you have a depression that has not responded to anything else, it is reasonable to get some ketamine infusions. Also, what has happened is people are doing ketamine psychotherapy under the influence of ketamine, which is a whole other realm in the use of ketamine. And there's nasal sprays of ketamine that people are using at home as sort of a maintenance after the initial infusions.
So ketamine has a reputation for being a tranquilizer. Some say that it was an animal tranquilizer that they modified for humans. What should people know about the drug?
It is not something to be used on your own. That is for sure. They used to call it Special K when it was a club drug, and it's around a lot more now therapeutically. Listen, I have seen it work. A course of 6 infusions of ketamine in a really serious case of depression. My concern is in people with a history of addiction, I've seen it trigger a relapse. So I'm not enthusiastic about it in the setting of addiction. I don't know how he got his hands on so much that he was taking it at home.
Right.
But it wasn't just the ketamine. That's very important here to understand. He was on buprenorphine. He was on 2 different benzodiazepines, which for a recovering addict is bizarre and ridiculous. And in fact, if you look at Whitney Houston's daughter, same exact combination, benzo, opiate, fell asleep in a pool or a bathtub, drowned. Same thing here, ketamine just added to the situation.
Now, look, Dr. Drew is the man, right? And what some of you may or may not know about me is that I have been in and around addiction and recovery most of my life, and I've covered it over 25 years as a journalist. The odds on of what happened here is that he was self-medicating again. Maybe he was drinking, maybe he wasn't.
Yes.
But very often people shift away from what their original drug of choice was and find other ways. These are all downs. It reeks of self-medication and him overdoing it and drinking and sinking into the tub and drowning. Not to disparage him in any way. I loved his work, and I know he was loved and beloved. But this is pretty familiar.
It's a progressive illness. It ends in death. Progressive illness ends in death. But the fact that, look, there's a darker thing hidden in here. Buprenorphine is a treatment for opiate addiction. It is an opiate. And when people are on an opiate for opiate addiction, it's not as though their addiction is gone. They frequently will use other things. And this is one of the great mistakes that people in addiction medicine make. They go, oh, good, he's on Suboxone. They ignore the fact that the patient will often start to use other substances and will complain of sleeplessness and anxiety from the opiate, and they give them a benzodiazepine. Somebody had to prescribe that. That is absolutely, in my opinion, out of the question. And then getting his hands on ketamine on top of that, it's wild, it's dangerous, and for somebody with addiction, you see where it goes. It's a terrible, terrible tragedy.
Right. So, and then for those, the uninitiated, and God bless you that you are, how does he get multiple doctors? Different types of people who traffic in these pills, especially for the famous. Friends who do this, who think they're helping, or enablers in his midst. I mean, this becomes a culture. This becomes a personality. It's a lifestyle. And it doesn't mean that he's bad. It doesn't mean that he was lying.
No.
Look at Prince, indeed.
He would... Yeah, but he would have to be lying. He would have to be lying because people with addiction, if they don't lie,
don't look at him as a liar, as a character flaw.
No,
this is part
of his illness.
That's what I'm saying.
It's a symptom. It's a symptom of the illness. And it's, if my patients didn't lie to me, their diagnosis would be in question. It's just part of the condition. And it's something I have to kind of see through. But yeah, you're absolutely right about the way you're painting this. This is a really sad progression of an illness. He had multiple medical problems too. He had emphysema, he had chronic pancreatitis, he had liver disease, he had heart disease. I mean, his autopsy was just, it was disturbing to read all the terrible problems he's done to himself.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.